Static pressure is a pressure that is exerted on the walls of the vessel, because static pressure acts perpendicular to flow, and exactly static pressure we measure by manometer during patient examination. This pressure is formed by cardiac output, which is the volume of blood being pumped by left ventricle per unit time, basically its flow, and by systemic vascular resistance. To understand what is P static, we have to know how P static is formed. So let's take horizontal vessel. Now we take some distant portion of fluid in this vessel, and the concept is that on this portion of fluid act two forces. Force from the surrounded fluid from the left side, that is pushing this portion of fluid to the right, let's say F1, and force from the surrounded fluid from the right side, that push to the left, let's say it's F2. And if F1 is equal to F2, fluid is static, because forces that push our portion of fluid are equal from both sides. But how these forces are formed? First of all, force is equal to pressure times cross-sectional area of the vessel. And the concept is that at every point through this vessel, fluid has hydrostatic pressure that acts in all directions due to the physical properties of water. And pressure that is applied to cross-sectional area gives force. That's how it occurs that our portion of fluid becomes compressed from two sides, and because fluid is incompressible, in response to compression, our portion of fluid exerts pressure in all directions, including the vessel wall, and exactly this pressure on the vessel's wall we understand by P static. The illustration of this compression is that when we take a balloon filled with water and begin to compress from two sides in horizontal direction, the balloon walls begin to distend perpendicular to applied pressure in vertical direction. Clinically, we measure P static by manometer, but to measure P static very accurately, potentially we can make a hole in this vessel and place there a vertical pipe, and the height of the water column in this pipe will be the measure of static pressure. The static pressure at this point will be equal to ρgh. By the way, if we place a tube with opening that will be orientated horizontally and will face flow, the pressure that it will determine will be bigger, because in this case it will determine not only static but also kinetic pressure, because kinetic pressure acts perpendicular to flow, and the sum of static and kinetic pressure called total pressure or stagnation pressure. So how cardiac output and systemic vascular resistance affects P static? The principle is that if F1 that push our portion of fluid to the right is equal to F2 that push to the left, fluid is static and flow is absent. Recall that force is equal to pressure times cross-sectional area of the vessel, and because force times distance is work, we can say that work 1 done by the fluid from the left side is equal to work 2 done by the fluid from the right side. And the concept is that fluid cannot move through the system without some additional pressure that is applied to it, because to create flow in direction, for example, from left to right, work from the right side must be bigger than work from the left side. So to create flow, something needs to provide external work. And in our cardiovascular system, this external work that creates flow is provided by the heart. The heart job is to create just enough pressure to create flow. So in our cardiovascular system, heart works as pump. The mechanism is that when left ventricle contracts, it pushes some volume of blood into aorta. By this, heart creates flow in cardiovascular system. And when flow that is created by the heart in aorta interacts with vasculature resistance, according to Ohm's law, it generates pressure in aorta. And exactly this additional pressure is required to push blood further through cardiovascular system. And because pressure times cross-sectional area is force, we can say that heart generates additional force that push our portion of fluid through cardiovascular system, and force times distance is work. So we can say that heart provides additional external work that overcome negative work done by the fluid from the opposite side, and now when positive work from the right side is bigger than negative work from the left side, flow is created. What we also have to understand is that this additional force created by the heart by pushing some volume of blood into aorta, which is basically cardiac output, will cause increase in static pressure exerted by our pushing of fluid on the vessel wall, because cardiac output will increase the force that acts on our pushing of fluid from the right side, and by this compression of fluid will increase, and by increasing compression the pressure that is exerted on the vessel's wall by our pushing of fluid will increase, and the higher become cardiac output, the higher the force that acts on our pushing of fluid, the higher is P static. Another factor that greatly affects static pressure is systemic vascular resistance. For example, when thrombosis occurs that causes obstruction to flow, systemic vascular resistance greatly increases, and this causes increase in force that acts in opposite to flow direction, and this increased compression of our pushing of fluid, now from the left side, that subsequently will cause increase in static pressure. The same example, if cardiac output increase, we press the balloon from the left side more strongly, or if systemic vascular resistance increase, we press the balloon from the right side more strongly. In both cases, it will cause increase in distension of balloon perpendicular to compression. So that's how cardiac output and systemic vascular resistance form P static.